Hello, my name is Kateryna Nahornyak. I'm a third-year optometry student at SUNY College of Optometry, and I'm president of the Student Glaucoma Society at SUNY. Our idea was the mobile contact lens insertion and removal station. We came up with it, Joanna Latek, she's president of the contact lens club at SUNY, and we noticed that during a lot of the INR, insertion and removal times with the patients, we would have to place a mirror on their lap, and a lot of these patients are a little bit older and they have some issues with dexterity and being able to insert the contact lens without having to sort of bend over, be uncomfortable, sort of get their pants wet with the contact lens solution. So we kind of wanted to come up with something that we can move from room to room, just like a blood pressure machine that is very mobile. If you have anything that you might think of that might make clinical life a little bit easier, but you're not sure about it, I think it's definitely an idea to explore and see what you can do with it, because Joanna and I were just sort of talking about it one day after scribing for Contact Lens Clinic, and we saw the email about this award, and we sort of thought, why not make this a reality? Let's see what we can do with this, what kind of resources we have to plan it. So at the time of the Innovator Award and preparing for it, we were second years, and as everyone knows, that's pretty challenging, and we already have a lot on our plates. However, if you're passionate enough about something, you'll always find some time for it. We would meet up on weekends at the library upstairs, draw some drawings to see what our mobile contact lens insertion removal station would look like, scrap some drawings. We have a lot of different prototypes that we came up with at first. We really just put time into it because we were very passionate about it. We made the slideshow. We really thought about how we can break it down so that our idea is clear, what our goal is, how it can help the clinical community in general, and really just organize that on the slides so it's a clear and concise idea that anyone can really envision and understand. There's a way that we've been sort of doing insertion and removal trainings, both at SUNY and at private practices in general across the country. We were really passionate about the idea of making it all about the patient, making it easier for the patient, and sort of having something that is mobile and can accommodate to your needs at your practice. So that sort of really just kept us going forward, and we even spoke about our project with some of the contact lens doctors, and they agreed with us that yes, that would actually be much easier for them if it was to be used here at SUNY or at any other practice, and that kind of really pushed us to keep going forward despite the objections. Innovation in optometry actually, I believe, is happening all the time. There's always new ideas coming out, new contact lenses coming out, new ways to really improve patient care, and there has been so much in the past 10-15 years, even with, for example, like OCT machines and imaging. How much has that helped, for example, the retina clinic and retinal specialists in finding etiology of disease? Innovations are happening in all fields of optometry, so definitely I encourage contributing to that with your ideas. Just do it. You absolutely should. You never know what your idea may grow into. Any idea that you may have, if you want to do it yourself or do it with a partner, just really try your best to come up with different ideas. You have some time to come up with what you want to do, and you never know, it might change the field of optometry forever.